So, one area of concern for drug and alcohol use is drug and alcohol use on college campuses. There seems to be something about the college experience that brings this out, and it has historically been quite dangerous. Now, here's the good news. The good news is binge drinking is actually coming down on college campuses, but you can see it's still higher among emerging adults on college campuses than emerging adults who aren't on college campuses. And you can see that it is related, binge drinking is related to a lot of bad things. 25% of college students say that alcohol has hurt their academic performance. A number of deaths, about 1,500 deaths a year, 600,000 accidental injuries, 700,000 physical assaults, both physical and sexual assaults. So it creates a lot of problems, but we're very happy that it's coming down. Now, what do we do about this? So if we have an adolescent or emerging adult who is addicted, what do we do? And the problem is that both treatment and prevention are a bit difficult, because treatment is difficult because adolescents and young adults don't typically have a lot to lose. So it's can be unclear to them what the substance abuse is interfering. And then prevention is difficult because we live in a culture of pervasive substance abuse among adults of all ages. So that can also be difficult. So it's just really hard. I wish we had a better answer. In order to treat and prevent substance abuse in adolescents, the key is to focus on realistic health and safety risks of substance abuse. So there, you don't ever hear this anymore, but when I was in high school, we'd be told that we were going to be homeless and never be able to have a job or anything fun if we drank. And of course, that's not true. So you need to be realistic about the problems that could be associated with it. Parental monitoring, right, of adolescents, and then also improving family functions so that you don't have an adolescent who's escaping a really difficult family situation. There's also this interesting phenomenon that happens where if a college student feels like more people are binge drinking than actually are, they're more likely to binge drink themselves. And so one preventative strategy has been to publicize what percentage of college students have actually binge drank in the last 2 weeks. So about 40% of college students report binge drinking. But when you ask, they'll say, oh, like 70%, everybody, does it. So it'll be there'll be signs that say only 40%, less than half of college students report binge drinking. One of the things that can be a problem, so it's just kind of like the marijuana ads, it can increase drinking rates in low to moderate drinkers. So it's like, if the rate that is being posted is higher than what they suspect, it can increase it. So you have to be a bit careful with those programs. So instead of 40%, you probably want to say less than half, right? Do know that vaping rates, we've already talked about vaping in other chapters, vaping rates are increasing quickly, and vaping rates are higher in college aged emerging adults than in non-college emerging adults. And this is crazy, isn't it? The jump, it's the greatest 1-year increase seen for any substance in the history of the survey. So vaping is just pervasive across the board, and it's pervasive in high schools as well. The other thing is you can vape marijuana, right? Which is probably one of the reasons why marijuana use is going up a bit these days. And you can see the vaping rates of marijuana have increased in college students. It stayed about the same in non-college students.